My name is Philomena Keating. I have been a registered nurse for many years, and I started working at the State Hospital Number 2 around in the 1980s, and I worked with the mentally ill for several years, and I must say I really learned an awful lot there from them. I had been working at, I've always done acute care, and a friend of mine was actually working there and I was ready to change and learn something different, because I had been working acute care for many years, and I've always had an interest in mentally ill patients, and I think no matter where I've worked, you encounter those problems. And an opportunity presented, and I decided to apply. You have to apply to the state of Missouri and get approval, etc. And this job became available, and it was really, I was assigned to Buchanan, one of their campuses, and what shall I say? It was a great experience in many ways, sad but very good. I learned an awful lot. The orientation was one of the best I've ever had, and it was actually a good 6-week orientation about mental illness. And I must say that was something that stuck with me, and it helped me with other patients as well throughout my career. The RN on the unit, which is usually just one RN, you're responsible for all the admissions that would come through. You have to do a full assessment. It takes about an hour, actually, maybe longer. Yes, you're responsible for the admissions, and then if they're going to be like on a 96-hour hold, we're able to initiate, if you're a designee with the state of Missouri, which I've always been actually, I could initiate the 96-hour hold, read them their rights, etc. It's quite a procedure, and at that time people are not too happy because they're in there to begin with. But we're responsible for that. We're responsible for discharges, basically. You have to, and the social worker also has input, and obviously the social worker is the one, if they're going home, prepares that part of it, okay. But we have to do all the paperwork and get all their medications sorted out and the documentation and have their discharge papers ready, and we're responsible for them until they're in a vehicle with the door locked. Of course, ongoing during the day and after doctor sees patients and medication changes are made, and obviously they're called to the pharmacy, which is and still is where the Glory Museum is right now. However, the only access we had, and we always had to go through the tunnel, be it day 3 to 11 shift, and get the medications. They would have them ready for us and go right back through the tunnel. At first I thought it was a bit scary, but then there's one tunnel in particular that people have drawn, and it used to be, patients used to be able to go through there. But I found that quite different. So individual and group therapy every day, occupational and recreational therapy, medication education, which we did anyway, and we had to do it on discharge as well for patients. Discharge preparation is basically done, initiated on the treatment team, and then followed through with, the social worker will arrange whatever placement, and the nurses do the rest, call in the pharmacies and medication, etc. And of course, during their time there, they'll always have individual therapists with like a psychologist, and with the doctor, obviously, will speak to them one-on-one. And that's daily, basically, and even, so I found the physicians that were working there at the time, I found them very easy to work with, and you could actually call them at any time, and if they had to come in and see the patient, they would. They had to come in anyway if a patient was in restraints. They have to be there with, the doctor is the only one that can give a restraint order, and they have to be in within like a 30-minute period to evaluate the patient. And then the fun part was sometimes they had pet therapy. People would bring in their pets, and the patients really look forward to that. And you realize, how important, and the dogs or even the kittens, etc. And then music therapy. And I wish I could remember his name. I think he's deceased since, but he was blind and he was the best musician. And it was amazing. And patients would sit around and listen and sing. It was very, very therapeutic. And, you'd think a lot more of that would be probably worthwhile. The only ECT I saw there was with one doctor. He included me on it, and I was a bit alarmed at first, but he showed me technique and everything, and the patient was awake, and until they induced a seizure. And then the follow-up on that patient, I'm not sure, because I think I was on a different unit, so I'm not sure of the progress, but usually there's good results. But it's a thing of the past doing it like that. It is now a surgical procedure done down as outpatient in OR, and which is probably a much more humane way to do. But it is court ordered. You can't go and just order it now. It has to go through the court as well. I think in the later 80s, because I believe I haven't got the date exactly, but it was around 90, because the new place opened in 94, so the transition was ongoing. Initially, the staff wasn't really aware. It's just like, we weren't really told, but we could see the writing on the wall, and some of the staff were already, maybe they knew they were looking for different alternate jobs, and the patients were beginning to get restless as well, especially when staff were leaving. A lot of them, and I was lower seniority in terms of how many years I'd been there, and it was closer to that time that I determined I would just go back to acute care, and I really liked it there. I must say I never hated going to work at all. But for the patients, then as time progressed and they knew that they were looking to get them placed wherever, group homes here in town, or maybe in areas that they didn't want to go, you could tell that they were getting a bit more agitated. And one lady, and I remember her clearly, and she had been in there for many years, and she said, I don't want to leave here. She said, but if they make me leave, I want to come back here. This is my home, and I want to be buried here. And they did have a cemetery, and there are so many buried there. And that's, I think she was speaking for a lot of people that felt like that. It was home, and after, I suppose, if you're there for 20 years, but she said, I don't care, I don't want to leave, but if I have to. I said, we know you talk about, what about if they get you a nice group home? It won't be the same. I want to come back here and be buried here. And I think that speaks for itself, and for the facility and the care that she got over the years. And I'm sure she wasn't the only one that felt like that. Well, I must say my time at the state hospital, I feel it was very valuable to me. I felt the education requirements, the orientation process, really learned an awful lot about mental health. Yes, there are flaws, and I would hope to see those change over time for medication, the costs of medication for patients, etc. And I was very sad to see the state hospital close, because we were a kind of a community to ourselves, basically, and I found some of the most devoted staff there, and there wasn't an awful lot of conflict, it seemed like, and I feel the time I worked there was valuable for me, and I never forget those tunnels. I would just hope to see ongoing changes for mental health and mental health patients, better facilities, better treatment, and I think we're getting there, but no, we're not there yet, because we still have patients that can't afford their medication. They're homeless, basically. A lot of them, you see, our mental health patients are homeless. They don't really have family after all those years. A lot of them are, if they don't have family that are willing to help them. And I feel in a way, yes, group homes and everything are good, but I still think that state number 2 seemed to provide a home for people at that time, even though the treatments were, thank goodness we've advanced from a lot of those treatments, and hope for a better future for them, because it could be any of us at any time. Right?